Hi, I'm Dr. Beech, and today I want to talk about a very common pain problem that patients come into my office with. It's called iliotibial band syndrome, or IT band syndrome. This means that the person has pain in the outside of the leg from the hip, going down to oftentimes all the way down to the knee. Many times the pain gets mistaken for sciatica, because sciatic pain is also leg pain, but the difference is sciatic pain goes down the back of the leg and will hurt when you stretch the leg, like driving the car or stretching out the leg, whereas IT band hurts on the outside. So if this were my leg, on the outside of the leg. Let's take a quick look at the anatomy of the IT band, and then we'll come back and talk more about it. So as you can see, the IT band starts with a muscle in the hip called the tensor fasciae lata muscle. That tensor fasciae lata muscle then has a tendon that goes all the way down to the knee joint, and then it allows the leg to abduct, which means it flexes outward. And what can happen with the IT band is that tendon can build up toxins in it and become inflamed because it gets too tight. So the most common reason that I see for IT band is that the person has pronated feet, which we've talked about in other videos, where the feet are rolling in, or flat feet. And as the foot rolls in, then the knee rolls in and the hip rolls in. So if the hip is like this, coming into the hip joint, because the feet roll in, the hips then internally rotate. And as they internally rotate, it stretches the IT band. And as the IT band gets stretched, then the circulation reduces in that area. And as circulation reduces, then whatever inflammatory toxins are floating around in the system trying to be eliminated, they'll slow down and get stuck in those areas. And as they get stuck, then they inflame the tissue, causing little trigger points or knots, inflammatory nodules. And you can feel those nodules if you have IT band. You can take your hand and just work your way down that way, down the IT band. You know it's the IT band because it's sore, and every now and then you'll find this little knot, and that little knot will be really sore, and that's just a buildup of some sort of inflammatory material like lactic acid, or in Ayurveda we would say amavisha, which means an inflammatory toxin. Now, the way to treat this, at least in my office, the way that I treat it, is I think probably three ways, or four things that we might do for IT band. Depends on the particular person. But one would be to look at the feet. We have to always look at the etiological factor. In Ayurveda, we call this the hetu, the etiological factor. And in this case, it would be that the feet are pronating, putting stress on the IT band. So if that's the case, then we make custom molded orthotics to go in the feet to correct that. I've talked about that in other videos. Remember that not all orthotics are made the same. They have to be designed to correct the biomechanics of the body as opposed to just correcting foot pain. Secondly, treating the IT band itself through stretching. There are certain stretches that one can do that we teach you to stretch the IT band out. That's a stretch for the IT band. And then we can do physical therapy on the area. Electrical stim is very helpful for reducing the inflammation. But then in my practice, because I use Shakavanti Ayurveda, I have many different kinds of transdermal creams that are good for pain. One transdermal cream that I would use on this area would be what's called Flex and Flow. There's a couple more called Super Sport or Mahaveda Nishanti. Any of these three creams will help the pain, but they very much, if this is the IT band, we're going to apply it on the area and swipe it down 7 times. And it'll open up not only the physical channels, but the vibrational channels that allows the life energy, what we call prana, to flow in this area. That's very, very important so that the body recognizes those toxins and releases them. The other cream that I would use is pain relief cream. We have a new name for it now. And that cream is very, very good for breaking down those nodules. And again, the way to put it on is to apply it And then what I have the patient do, this is pretending that this is my leg and this is where the IT band is, this would be the hip and this is the knee, is I have the patient maybe cross their legs so that they can get to that area easily, and then just work their way down slowly, rubbing the area and breaking down those nodules a little bit by rubbing, and then taking the cream and swiping it. I suggest that they do this twice a day, morning and evening, but the massage part we only do once a day, and then just the swiping another time. If you massage too much, it'll make it inflamed, and then that'll aggravate it. So just once a day on that. And then the other caution I give my patients, if you come back to it the next day and it's more sore, it means that you were a little over-enthusiastic with the massage, and should just skip the massage that day and apply the cream. Usually, if the person does this consistently for 2 or 3 weeks, along with correcting those etiological factors, the IT band goes away, IT band syndrome goes away. So I hope this is helpful. Thank you.